You know the feeling, you've had it before. It feels like you've been hit by a truck. Every muscle in your body aches, your head hurts, your stomach is upset. You probably have a fever, but you felt fine a little while ago. You more than likely have the flu. Caused by the influenza virus, the flu is a very contagious respiratory infection. It comes on very abruptly and is usually during the months of October through May, more commonly known as flu season. Today, I will inform you about the flu and tell you what you can do to prevent yourself from getting it. Many people confuse the flu with a cold. Although they are both considered respiratory illnesses, they do have different symptoms and are caused by different viruses. It is important to know the symptoms for both the flu and the cold because it can be hard to distinguish between the two of them at times. As I mentioned earlier, the flu comes on more abruptly, whereas a cold occurs gradually over time. Fevers over 100 degrees are more common with the flu than with the cold and can last up to 3 or 4 days. With the flu, your body may experience severe aches and pains and you will get the chills. Both of these are very rare, which is the cold. When you have the flu, it is not unusual to feel weak or very tired. Although this can be a symptom of a cold too, it is usually not as severe as it is with the flu. Sneezing, sore throat, and stuffy nose will not be a common symptom of the flu like it is with the cold. Coughing or discomfort in the chest is also a symptom for both the cold and flu virus, but with the flu it can tend to be more severe than with the cold. A headache is also more common with the flu than with a cold. More severe symptoms usually found in adults that should be checked out with a doctor immediately include trouble breathing or shortness of breath, extreme pain in your abdomen area or chest, dizziness that comes on suddenly, and extremely confused or persistent vomiting. Extreme symptoms in children can include breathing very fast or difficulty with breathing, skin color that appears very blue, dehydration or not wanting any liquids, incoherent or sleeping a lot, irritability, and a fever that also contains a rash. Once you've determined if it's the flu that you have, it is important to know that there are 3 different types of viruses. The first type is influenza A. This virus is not only found in humans, but also in animals such as chickens, ducks, or pigs. It can be spread worldwide and includes the H1N1, H1N2, and H3N2 viruses. If you recall, a couple of years ago, we had an outbreak of H1N1, which was referred to as swine flu. The second type is influenza type B. This virus is mainly found in humans and is much milder than type A. An epidemic can easily be caused by this type of outbreak. Lastly, the third type is influenza type C. This is a virus that usually only causes a mild respiratory infection, and the outbreak will more than likely not cause an epidemic. This virus can be found in dogs and pigs as well as humans. Because the flu virus is always changing, a new vaccine must be developed each year. After learning about the symptoms and different types of flu viruses, here are some ways in which you can help relieve your symptoms. Many over-the-counter medications can help you get temporary relief, such as ibuprofen, which will help you with your body aches and pains. Tylenol will help bring down your fever. Antihistamines can help for watery eyes or runny noses, but may cause drowsiness, so it is important to know the side effects before taking any medication, especially if you'll be driving or operating machinery. Decongestants can help with nasal congestion, and cough suppressants can help calm your cough. Although these are all great solutions for temporary relief, wouldn't it be better not to have to deal with having the flu at all? Ways in which you can prevent getting the flu are pretty common sense. Just by simply washing your hands frequently in lukewarm water for approximately 20 seconds each time, you are making a huge difference in reducing the risk of getting the flu or spreading the flu germ. If you sneeze or cough, make sure to use the sleeve of your shirt or a tissue. Never use your hands, and if you do, go wash them immediately. Get the flu shot. You can choose between the vaccine, which is given in the arm with a needle, or the nasal spray that goes in your nose. This will need to be done each year though, because as I mentioned earlier, there is a new vaccine each year. Nobody wants to get the flu. The problem is people don't usually worry about it or think about it until it is too late. At this point, it's too late for prevention, but you can apply the good oral hygiene tips to make sure that you do not spread it to the people around you. For any other information on the flu, you can go to www.flufacts.com, kidshealth.org, or www.webmd.com.